Well, welcome everyone to the Medicine Forward Town Hall tonight. I'm super grateful and excited that everyone is here with us. My name is Gabe Charbonneau. I'm a family practice doctor in rural Montana and the co-founder of Medicine Forward. I want to just tell a little background about what this group is all about and how we got started, especially for anyone who is new here. So Medicine Forward is a grassroots doctors organization that started about 4 years ago. And it began after I became friends with Eric Topol, and he wrote this piece for the New Yorker saying that it was time for doctors to organize in new ways, that that some of our existing professional societies really weren't able to do what they needed to stand up for the doctor's voice, and even more than that, for us to be able to meaningfully stand up for our relationships with our patients. And so Eric wrote that piece. I was inspired by him and told him that. And then he said, okay, great, Gabe, I think you need to help start this organization. So we, after that, a few of us started banding together. And since then, we've basically just met regularly and grown a small tribe of people who are interested in advocating for a better future for medicine, and especially for standing up for the human side of medicine. So we've done a series of events so far. We first did a launch town hall. After that, we did an event with the American Medical Women's Association that was and also with the Lorna Breen Foundation, that was really about standing up to mental health stigma and the licensing questions that were getting in the way and causing problems. We did 2 events with the American College of Physicians, ACP, that were all about disrupting prior authorization. We have gotten some of the group of Medicine Forward together at a retreat in Washington, D.C., and we also partner with the Burnout Symposium, and I was a speaker there in February talking about the need and what we could do to start a social movement to make a difference in burnout, but also bigger than that, make a difference in positive transformation in healthcare. So that's a little bit about the background of the organization. We've had some amazing people be a part of it, and I'm so excited and grateful for everyone that is here with us tonight. I do not want to talk for a very long time, because this is really to highlight Gabe and what he is doing with his Good Trouble group in Indiana, and also about the participatory part that we do in breakout groups after that. But I do want to show one slide, which I will share my screen here real quick. Share my screen, and okay, so this is something that we've put together that we call the Medicine Forward Theory of Change, and it's really meant to articulate how we think we can have leverage to make a difference. And essentially, I'll summarize, there's really 2 pathways. There's kind of an internal pathway and an external pathway. The internal pathway is things like we're doing right now, like bringing together groups of like-minded and interested people to build community and find common interest, and do what we can to network and build relationships with each other. It's also about building skills, including coaching, to learn skills to make us more effective change leaders. And then the other part is a national engagement campaign. So that's where we pick issues that are important to us and figure out how we can convene people and resources and put those things together to really try and have an impact on those national issues that matter. And the theory is that by doing both of these pathways together and having them complement each other, that if we really focus those things, that we can increase a sense of doctors having a voice and a sense of agency, and that we can start to catalyze some positive transformation in this broken mess of a healthcare system that we have. So this is our theory of change. I guess there's a lot on the slide, but the key thing is those 2 pathways, and that it really is just about focusing the resources that we have to make a difference. I'm going to stop sharing my screen for just a second. The other thing that I want to highlight is stop screen share. Okay. The other thing that I want to highlight is that we'd really like people to check out the Medicine Forward website if you haven't. We're trying to curate resources there that are all about useful articles and people that are doing things for making a difference to disrupt the status quo and make things better. And we'll continue to curate resources there. We also will put recordings of our town halls. So like the thing that we're doing tonight, we'll put a recording on there. Some of the previous ones are on there as well. Also we have a social platform on Mighty Networks, and we'd love to have, if you're not already on there, have you join us there. It's a place where we can interact with each other more directly, and it's just a good place to post things and connect with others. It says that it's really only for doctors, but we've learned that this is something that's bigger than physicians. And I guess I'd like to throw out there that if you are interested enough to be on this Zoom call with us tonight, I consider you a friend of this movement, and you are welcome to join us on the Mighty Network. And we continue talking about like how do we figure out the identity of this group. But we really want to bring anybody who wants to be part of this change to together and part of that effort. And so with all of that said, I really want to just jump in and get started with introducing tonight's main event. So first, Todd Otten. Todd Otten is a new friend over the last few months. Todd is a family doc in Michigan. He has a huge heart for change. He and a friend who's a patient recently wrote a book called Ripple of Change. And they wrote about things that have been challenges, but also a vision for what could be and how to make things better. Todd has just been voraciously networking and trying to meet people that he can to figure out how he can be part of making a difference, and has been super generous with his time with Medicine Forward and so helpful. Really has become like one of the go-to people for helping keep things going here and help put kerosene on the fire of Medicine Forward. So I'm really delighted Todd's going to be our moderator with my other friend that I'm going to introduce shortly, Gabe Bosslet. So thank you, Todd. And then I want to just briefly introduce Gabe Bosslet. Gabe and I met, I think, about a year and a half ago, and we got on a Zoom call together. And actually, this is the thing that I didn't want to give a spoiler about, but now I'll show this. So Gabe, I found this picture. We got on Zoom and we realized we're both at the time 44 years old. We have the same white patches in our beard. We looked like we could be brothers, and we were both very, very passionate about advocating for change. And so we got on another Zoom, both wearing similar shirts and beanies, so that we could make this picture happen. So I thought people might enjoy seeing that.
That's terrific.
Gabe is a pulmonary and critical care doctor in Indiana and has started this wonderful thing called Good Trouble, which I'm highly inspired by. And it's basically a grassroots effort that he's put together with some friends because they had things that they deeply cared about and wanted to do something. And I just think this model of saying like, I care enough, I'm just going to figure it out is really extraordinary. And so I was delighted that he was willing to be here and visit with us and talk more about that tonight. So I've already taken too much time. Todd, take it away.
All right, so I'm on the clock now. Gabe, it's wonderful to have you. I wanted to start actually with a couple quotes that you had from your Stat First Opinion podcast with Dr. Wilkinson. I thought that was a fantastic podcast, and for those of you who are interested, definitely check it out. A lot of great detail there, a lot of nuggets, etc. So I'm going to do my best impression of Bones from Star Trek because I possibly paraphrase some of this. Damn it, Gabe. I'm a doctor, not a stenographer. All right. I appreciate the generous laugh there. That's good stuff. Okay. So the two things were physicians have been silent for a long time. Everyone is not leaving us alone. That really struck a chord with me. And then the second one was, as physicians, it is intrinsic in our roles to speak up for issues of public health, patient safety, and health equity. And doing that requires that we tell stories. I would love your thoughts on those couple of quotes that were from you, sir.
Yeah, that podcast was born out of a piece that we wrote for Stat at 3 a.m. after Caitlin Bernard's medical licensing board hearing, which went from 8 a.m. here in Indianapolis to about 11:30 p.m., where she was found, where she had been attacked by our attorney general and had been found to have broken privacy laws, which is very debatable. And we all, me and Tracy and several others, went back home and like, we have to write something. And so, yeah, that, that's one of the I've written a good bit since the pandemic and since Good Trouble started. And if there's one piece I'm most proud of, it's that that Stat piece, both the written piece and the accompanying podcast. And I think the second quote that you mentioned there is the one that I like the most. The way we change hearts and minds is through stories, full stop. Data is wonderful. I think we all saw the failure of data during the pandemic to really win over folks that are less interested in science and evidence than we are. And so one of the lessons that I learned is that, stories are what often work better to turn hearts and minds. And so I think that's all true. I think that the pandemic taught me and laid bare for me that we can no longer just sit and let things happen. We have to be an active members of society and of civic discourse.
So well said. That is just fantastic, and so is your shirt, by the way. I absolutely love your shirt. It's just wonderful. Before we dive into the Good Trouble Coalition, who was your biggest inspiration in becoming a physician?
My dad. My dad graduated college and managed multiple Taco Bells until I was about 3 years old. And we lived in poverty, frankly, government cheese and cereal. And he befriended a professor at a med school who said, why don't you do the prereqs and try to get in? And he got in and went on to be the chief of staff at the hospital where he was for, I don't know how many years, and just recently retired. So without a doubt, it was my dad. He hooded me at my graduation ceremony.
That warms my heart, just that story right there. So why don't you tell us about the Good Trouble Coalition, specifically the impetus for its creation and its mission?
Yeah, the Good Trouble Coalition would never have happened had the pandemic not happened. Before the pandemic, I was like most physicians and sort of content to just go to work and be left alone. And then, the virus came and, well, if I'm honest, like the very granular story is, we were opening a new intensive care unit in November of 2021. So not 2020, 2021. That was the year when things got really bad here in Indiana. 2020 was bad, but 2021 was worse. And so we were making plans to open an ICU that had been shuttered for 12 years in order to triple our ICU capacity at the hospital that I work at. And at the same time that was happening, the Indiana the state house, so the state legislature, was debating House Bill 1001. And House Bill 1001 was a bill that would have made it illegal for employers to have as a requirement for employment vaccination, including hospitals. So trying to tell hospitals that you are not allowed to require your employees to be vaccinated at a time when our ICUs were full and filling with unvaccinated people almost exclusively. And I got super pissed off, frankly. And I'd never testified at the state house, but I went to testify. And I was in a room of probably 200 unmasked people. Almost all of them were anti-vaccine. There were 4 physicians, 2 of which wound up jetting because people were asking for our contact information, our addresses. And so they were like, we're out of here. And I stood up and I spoke. I was ashamed that I was one of the only ones to speak, that I was one of two in this room of 200 people. And that sort of lit the fire, frankly. And then, some other ridiculousness happened in the state house. We passed a permit or an open carry law that basically means in Indiana, you can, without any background check, own a gun and carry it wherever you want for without a permit. And that went into effect right after Buffalo and Uvalde, summer of 2022. And that was right after Dobbs, the leak of the Dobbs decision. If you remember, the leak was in May, the decision was in June. And I got really mad. And so I sent a tweet, and I'm on Twitter. I'm not on Twitter now. I have sworn it off, but I was on Twitter a lot. And I sent a tweet that said, if you're from Indiana and you're a physician and you're frustrated with the way things have been going, DM me, because I'm looking to make some good trouble. And I'm sure I just had one extra cup of coffee that day, frankly, because I didn't have any plan for what the hell we were going to do. But I knew I was pissed off and needed a place to go. And I looked around for places that were doing this work, and there were none. Right? Our State Medical Association in Indiana is an organization that really protects physicians' pocketbooks more than it protects health of Hoosiers. And so I was frustrated by their real lack of teeth to what they were doing. And so I, was lucky enough to be able to pull together a critical mass of humans that were all upset enough to come together and create the Good Trouble Coalition. I didn't plan on naming it the Good Trouble Coalition. It just sort of organically happened. I argue with myself about whether the name is really what it should be or not from time to time. And that was kind of how it started. The first thing that we did was the governor called a special session in the summer of 2022 to ban abortion. And we wrote a letter and got it signed by over 1,300 physicians and healthcare workers around the state. And we were able to raise over $20,000 to publish it in 8 newspapers as a full page ad with all of the names of all the people. I have it hanging actually in my hallway. And there it is. I'm so proud of that thing. That was the first thing that we did. That was really the origin of the Good Trouble Coalition. And then we realized we needed to sort of get serious about it. And so we went through all the steps to become an incorporated nonprofit relatively shortly thereafter, and have been making good trouble ever since.
That's just stupendous. And that was the special word I wanted to use to extol some of your efforts. So there it is. I got it out early. But it's just wonderful. I can't tell you how awesome it is to hear our colleagues having the courage to stand up and fight back some of the injustices that are going on, because we're getting told how to practice medicine from every angle and by every entity under the sun. And frankly, it's a non-sustainable trajectory. So I applaud you for your efforts. I really think it's wonderful.
Thank you.
What are you working on currently? What is the coalition working on currently?
Today's Thursday, right? So on Monday, we put out a press release condemning actions by so I live in Indiana. This is a very red state. It's a southern state in the north of the country. We have an attorney general who is very hostile toward physicians. I'm sure many of you know the Caitlin Bernard saga and the little kid from Ohio who came here. So he took Caitlin Bernard to the medical licensing board and put before them that they should remove her license. They didn't. They did reprimand her and fined her $3,000, but she didn't lose her license. That wasn't enough. Last week, he announced that he's suing the hospital that she works for, which actually is the hospital that I work for, the largest healthcare organization in the state of Indiana, for lack of compliance of HIPAA for that case. And so we put out a press release saying this is ridiculous, that, the health system put out an internal investigation that they published months and months and months ago, well before the state medical licensing board action that said that there was that no PHI was shared, no protected health information was shared. So that's kept us busy. We're ramping up for our legislative session, starts in January. So our legislative session, luckily in Indiana, it's just 2 months every other year, or it's every year, but in this year, it's just 2 months. Because gosh, more than that, I would just probably have a heart attack. So we're getting ready for that, just trying to figure out, okay, where is the Overton window for this year? What are the issues that are going to come back up? And so, yeah, it's just mainly doing that. And then fundraising, this work is hard work. And this is nights and weekends work, right? It's 7:30 here. And I do my Good Trouble work after 5 and on the weekends. And we at Good Trouble have hired a legislative consultant or lobbyist to kind of help us at the State House. But we really need an executive director to kind of run the day-to-day. And we're getting there. It's just fundraising is hard. It's not something that's in any of our wheelhouse. So those are really the things we still feel like we're trying to get our sea legs under us. Those of us who are in Good Trouble and sort of in the board of directors. If you talk to people who are outside of Good Trouble looking in, they feel like we've got it all together. It's the duck, the under the water, the legs, the little feet are going like this. It's one of those things.
Well, and that's where I think there's an opportunity where we can all learn from one another, right? I mean, there are so many good efforts going on around the country. And unfortunately, what I've noticed in terms of in networking and talking to a lot of other colleagues and physicians and healthcare leaders is just as many silos exist in delivery of healthcare. There are silos in these wonderful endeavors to improve things, and I think that's some of what we're trying to accomplish today is to work on that synergy, that collaboration, that connectivity. Any additional thoughts on that, Gabe?
Yeah, I mean that I feel the exact same way. We've had to sort of build Good Trouble from the ground up, learn how to incorporate a nonprofit. We're lucky that our vice president is a professor in the School of Public Health who studies organizational nonprofits as her academic area of interest. So this was her first foray into creating a nonprofit. So it was really a terrific implementation science project for her to really take the theory that she studies and put into practice. She's one of my favorite humans in the world, Jamie. And so, yeah, we've had to learn a lot. But I will say that, there are multiple groups in red states, especially in the Midwest, that have created groups and are starting to come together. So there is a coalition of Midwest advocacy groups, Ohio, Michigan, Kentucky, Kansas, Nebraska, Missouri, that are all starting to meet. We're starting to have regular meetings to to share some of these best practices, because there is no reason why anyone should write bylaws for a 501c4 physician advocacy group at this point, because we did it and we have them, and I will gladly share them. So yes, there's a lot of opportunity for us to help others who want to be in this space, to make it easier for them. We've done some of the heavy lifting. Just let us kind of help.
That is wonderful, and that's where some of the duplicative nature of people's efforts can be eliminated. So I loved that comment, absolutely love it. I think it's incredible. Uh, on our podcast, the Ripple Change podcast, we have Ripple Challenge questions, and I might just ask two, just because my curiosity is through the roof at this point. The first one is, it's fall. Would you rather pick apples or pumpkins?
Oh, apples in a heartbeat. Honey crisps.
Perfect.
Yeah, but not Red Delicious. If it's a Red Delicious, I will go get the pumpkins.
And I've got to know, what is that circular thing behind you?
That is a Japanese moon gate that was installed by the lady who lived in this house before we bought it 13 years ago. And I get to look at it and power wash it once a year.
Oh, rarely am I at a loss for words, but you caught me off guard there. That's so good. So if you had to, we've got about 5 minutes left and maybe time for just a few more questions here. What would you suggest to our colleagues who are looking to amplify their message? What path should they do, or they're looking to take that first step? Any thoughts there?
Yeah, good trouble doesn't happen without a critical mass of people to make good trouble move forward. I am not good trouble, and I could never be good trouble. It just doesn't work. We have a board of director of 11 people. We meet once a month at 9 p.m. on a Zoom call. We met last night in person for a good trouble meetup. There were probably, I don't know, 30 people, much like this. People who were like, "Oh my gosh, it's so good to see people that feel the same way about this stuff that I do." So you have to surround yourself with people who want to do this work and want to, I mean, honestly, like we kind of rattle cages. That's what we're here to do. We are here to, the status quo is no longer working in Indiana, and so we're here to be disruptive. And so you have to find your tribe of humans that want to do that work with you. Because without that, this doesn't work. Without that, it's just me. I'm not sitting here talking to you guys. I'm power washing my moongate. Or doing something else.
Gathering your tribe is an outstanding idea, and I totally agree with that. My new friend Sean Nason calls his tribe a swarm. Um, so a similar type thought there. Um, on your website, you talk about direct action. Maybe could you speak to that a little bit and perhaps give an example for the audience?
Yeah, direct action is, I think most of Good Trouble's mission is legislative in nature. It's trying to enact large scale change. And for Good Trouble, our scope is the state house, at the level of the state house in Indiana, because that's frankly where most public health decisions occur. Direct action is literally providing benefit for an individual at the point of the interaction. So it's handing out blankets in the cold to homeless people. It's having a clinic for homeless folks who don't have any ability to get to healthcare otherwise. There's a reasonable contingent and several people on our board who their advocacy is at the level of direct action, and that is where a guy named AJ Sinha, who's a nephrologist, this is what fills his cup more than anything else. If I'm honest, I've done very little direct action. I will. AJ is going to continue to pull me in that direction, and I will start with 4 kids. It's difficult to find time, especially when I'm doing this stuff in the evenings. But yeah, direct action is exactly what it sounds like. It is literally providing help to individuals at the point of contact.
Perfect, 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 perfect. And I too have 4 kids, so I could appreciate the challenges that brings with it, if you will. We've got probably about a minute and a half left, so probably a perfect opportunity to transition here just a bit. Um, you know, there's a lot of frustration, there's a lot of anger, there's a lot of energy out there. And I think part of what we need to do as physicians and healthcare leaders is channel that energy into positive ways instead of arguing with one another about semantics or this, that, and the other thing. If you've got a frustration, figure out a way to channel that energy for good, make some good trouble. I mean, clearly it can be done, right? I was at a homily a few years ago and they talked about utilizing time, talent, or treasure, right? And perhaps you don't have the time and maybe you don't have the energy, but certainly everybody on this call is talented and can use that talent to one degree or another. And if maybe that's not your thing, perhaps donate to a cause like Good Trouble, or maybe donate a few bucks to Medicine Forward, right? Those are things that are gonna help turn this $4 trillion mess around, in my opinion. Just being here is a good start. And I'm at my 30-minute timeline. So Gabe, I want to thank you from behalf of everybody at Medicine Forward for taking the time to spend with us. We truly appreciated it. And I will throw out one last ripple challenge. What positive ripple of change, maybe not today, but what positive ripple of change will you make tomorrow?
What is tomorrow's Friday? I have clinic. And
Well,
my
you didn't have to
son-
answer, Gabe. I mean, you can if you want.
Oh!
That
I
was
thought
more of a
you were
rhetorical
asking me.
question.
Oh,
But I love
rhetorical.
that your mind's grinding
I was
towards the
ready.
answer, man. That's great. Good stuff. Thanks again.
All right, I'm going to jump in. I'm Jeff Cohn. I get to bring us into our breakout sessions, get them started. I'm a longtime Philadelphian, so I want to give a Philadelphia greeting to everyone. Yo, how you doing? I'm a retired hematology oncology doc. I practiced full-time for the first half of my career, which I spent at Einstein in Philly, a large inner city community teaching hospital. I then moved into a leadership role as I became the first chief quality officer for the organization, a position I held for 12 years. 8 years ago, I got trained and certified as a coach, and I see several of my coaching colleagues on this call. I want to welcome them, and I'm really glad they're here. That's my job now, and I work with physicians who want to work with a coach. And it's usually either because they want to move away from something in their life that's sucking the joy and fulfillment out of what they would like to be doing with their life, or they want to be moving towards something that's calling to them, usually professionally. It could be a new role they want to step into or a new initiative they want to spearhead, something like that. Even though I've been retired clinically for over 10 years, I still consider myself a member of the physician tribe. We've been using that word a lot, and it's something that I will always be. I feel almost all of our physician colleagues chose this career for a reason like I did, wanting to make a difference in the world, wanting to care for people who needed help, to heal, to serve, maybe even to cure. I'm a member of Medicine Forward because I still care deeply about what physicians care most about, their relationship with their patients. And I want to do what I can to restore and strengthen those relationships. In a couple of minutes, we all will be heading into a breakout room. We're doing breakouts to give everyone a chance to have their voice heard. One day, while I was in my chief quality officer role, I was walking a hallway with a resident toward a conference. Whatever it is we were talking about, I made a point that elicited from her the response, "There you go again, Dr. Cohn, stirring the pot." I was a bit taken aback by this, and she quickly added, no, I mean this in a good way. Every pot needs to be stirred now and then. So consider this breakout experience a bit of pot stirring. You may be desiring just to be in friendly conversation, and no one's going to be looking over anybody's shoulder. So if that's what you wind up doing in your breakout group, that's fine. But we're hoping for more than just friendly conversation. We are hoping that at least some of these conversations lead to actions. We're hoping for good trouble. So it's my pleasure to hand you off to Lisa Scardina, who's going to get us the instructions to help make our conversations what they can be. Lisa.
Thanks, Jeff.
Sure.
Really appreciate it. Lisa Scardina, I'm based in Portland, Oregon. I've been working in healthcare for 20 years with and for doctors, have a real passion for the work that we need to do to improve the environment for our physicians and providers. I currently work with a physician and provider recruitment firm that's really committed to improving the practice experience for doctors across the country. I have a big heart for this work and just really appreciate the opportunity to be with you today. We're going to move into breakout groups now. I'm going to ask Michelle to go ahead and put the questions in the chat, both in terms of a slide that we'll include in the chat that you can download, and just the text of some questions. These breakout groups were designed to just have 2 to 4 people, ideally of similar geography, to get together and have a conversation around kind of what inspires you and kind of what's your vision for the changes that you want to see in healthcare. So we'll be in breakout groups for 15 minutes. These aren't recorded. When we get back, we'll have a chance to debrief a little bit as a group and take it from there. So maybe just take a minute to go ahead and click on the breakout group instructions. And then from there, Michelle's going to press the button and you're going to show up with some friends. And if you don't find the right group, she's going to be hanging out in this main session to make sure that you find some friends. So with that, see you in your breakout groups. Thank you. Thanks, everybody. Did it work? Just a thumbs up or a nod? Were you in a room with some cool people talking about cool stuff? That's awesome. Appreciate that. Thank you. Right on. Well, welcome back, everybody, from your breakout rooms. And hopefully you had a chance to meet some like-minded folks. I see what you're saying there, Denise. Not nearly enough time, but super fun. I mean, just to kind of drop in and meet some people from maybe your part of the country or a different part of the country. Part of what we wanted to do to gather feedback, you're welcome to use the chat, but I don't know if you noticed in the meeting invite for today that there was also a link to what is called a Padlet board. Someone turned me on to this, like, hey, if you're trying to organize a movement, a social movement across the country, how do you do that? How do you capture good nodes of transformation and change agents? How do you connect change agents around the country? And so if we could get the link, Michelle, in the chat, and if folks want to go ahead and click through, and maybe I could go ahead and I can share my screen to give you a sense of what this looks like, and would encourage you to go ahead and consider from your breakout group or otherwise contributing to this board. And so it's super easy to do. There's a plus sign just in the lower right-hand corner. And just by doing that, it opens up a little box and you can add something that you learned about in your chat, something you're really passionate about. You can include a hyperlink or a photograph, anything, maybe an article, a conference, a book, a podcast, anything you might want to share here. And then we're going to leave this board open. So after today, it's available. You can like or heart what others are adding. And this is really important because the work that Medicine Forward is doing is really, again, bringing change leaders from across the country together. And part of the feedback that we've been getting over the last couple of months in particular, as things are ramping up, is just this desire to have an organization serving as kind of a federation of change leaders. How do we take good nodes of work going on around the country and aggregate those as resources, like we're doing here with this activity here today? So please take a look at that and please add something. I mean, this is another way that we're experimenting with how to communicate with each other. The second thing I'd like to draw your attention to, and maybe we can get dropped in the chat, and I'm going to switch over to the action steps that we're encouraging you to take from today's conversations. It's this idea, well familiar, be the change you want to see in the world. So we've got a link to the Good Trouble website, and it's kind of it's been a provocative question for the group that was organizing the event for today to wonder whether or not there could be another chapter of a Good Trouble Coalition in another state outside of Indiana. So learn a little bit more about what Gabe Bosslet is doing, and thank you for your generous offer of sharing the bylaws and information you gathered as you founded your organization to ease the way of others who might want to do the same. The second link is a link to the Medicine Forward website. Dr. Charbonneau shared at the top of the call just the work that we're doing and using a platform called Mighty Networks to connect with folks around the country. Consider joining. This is, we're a community of like-minded folks trying to make a difference. So inviting others to join in that conversation in that community. And then lastly, just this idea about speak up for change. And so we've got just links to find your representative, find your senator. Dr. Bosslet said along the way, as I was having a chance to get to know him and the work that he's doing, about some of his activities, including contacting his legislators every day around issues that matter. And that's something I haven't been doing, but have started to do more of, and am energized by the role modeling that he's provided of the difference that that really makes in improving the health of our communities. So those are some follow-up items for today. We'll go ahead and post the recording on the website and other kinds of things. But with that, I'll go ahead and turn it back over to you, Gabe Charbonneau. Thanks.
I am muted. I am now unmuted. So I won't take long. Thank you everyone for taking this time on a Thursday night. I know that the time was not ideal for everyone, but just the commitment and willingness to be here and show up for this is amazing. I want to say special thanks to Gabe Bosslet for volunteering to be our first guinea pig on this new round of town halls. It was an amazing experience for me tonight and super inspired by his work. Thanks to Lisa, Todd, and Jeff and Michelle for all of your hard work on bringing this together. I guess I mostly want to close tonight by challenging each of us to think about what were we inspired to do based off of this conversation, and we at Medicine Forward want to absolutely help folks who are interested in advocacy or being part of a positive change figure out how they fit in this movement. Our next community meeting is in 2 weeks on Monday morning at 9 Mountain Time. You can find out about that meeting on our Mighty Network, and we would love to see any and all of you there. And also, we just want to make ourselves available. So if you're interested in either doing something related to Good Trouble or otherwise related to the mission of Medicine Forward, we really just want to support people getting activated and finding out how we as humans fit in pieces of this social movement of creating positive disruption and change in the status quo of healthcare. So I don't need to say anything more, but I'm just super pumped and inspired by everyone who showed up tonight and participated and contributed. And I hope to see you at future town halls and on our Mighty Network and social media. And thank you again for generously giving your time tonight. And we're done 3 minutes ahead of time.
It's good.
All right. So go be with your kids and families and do something fun, and we would love to continue the conversation. Good night, everyone.
Bye-bye.
Bye.